ATLANTIS is a platform study, and it looks at testing different treatment options for patients with metastatic urothelial carcinoma who have completed chemotherapy and have not had disease progression at that point. And what we've been doing in the trial is taking patients as they pass through chemotherapy and undertaking biomarker testing of their archival tumour samples, and then using the results of that to allocate them to separate, parallel, randomised phase 2 trials. So the data we presented at this meeting was for the rucaparib arm of this trial. So patients that had a particular biomarker suggesting that their cancer might have a deficiency in DNA repair were eligible to go into a randomisation between rucaparib and placebo as a maintenance treatment. Of note, this trial and the recruitment to this study was undertaken before we had data to suggest that actually these patients benefit from immunotherapy. So this was done as a single agent monotherapy treatment with PARP inhibition. Having had biomarker selection done and having been found to have a biomarker that suggested that they may have a cancer with DNA repair deficiency, they were then eligible to go into screening for what is basically a placebo-controlled phase 2 study. So assuming that at the end of chemotherapy, they had at least stable disease, and that they were within 3 and 10 weeks of completion of chemotherapy, they were then randomised between placebo or rucaparib at standard doses. Rucaparib was taken orally at 600 milligrams twice daily. The primary endpoint of this trial was to look at progression-free survival. And this was a fairly small signal-seeking study, and we found an extension in the primary endpoint. So patients that received rucaparib had a median progression-free survival of 35.3 weeks compared to 15.1 weeks with placebo. So that equated to a hazard ratio of 0.53. The p-value was 0.07, which met the criteria in this study for statistical significance. We presented overall survival data. Those are inevitably immature at this stage. That was a secondary endpoint. We've also presented data for tolerability and side effect profiles, which were essentially similar to what's been seen for rucaparib in other settings, and have shown that this seems to be tolerable as a monotherapy treatment in this setting. This was a signal-seeking phase 2 trial. What we were trying to understand is whether or not there should be further development and testing of PARP inhibition in urothelial carcinoma, and we feel that the results of this trial justify that. So our primary conclusion is that further studies, further trials should be done in this disease. We think that it will justify looking in a phase 3 setting. The question that will come from this and other studies that have been presented at this meeting is where would that best be placed? So I suspect most likely that we're going to need to look at combinations with immunotherapy, potentially in the maintenance setting is the most obvious way to try to develop this going forward.